Before starting the mock, I'll just give a quick introduction of what communication mock is. So it will take around 5 to 10 minutes. And I'm hoping to do at least 3 communication mock today. And whoever, if anybody is willing to do the mock, put down your name. So the first 3 names, I will take their mock, if that's okay for everyone. All right. So put your name in the chat. So whose name is there? Okay, Pankaj. So the first 3 names will be selected and I'll give them chance. Are you all able to see the screen?
Yes, ma'am.
Okay, perfect. So I understand this is a mixed group where there are people who are newly starting to prepare, as well as some of you are going for exams. So I'll basically touch about what these communication stations are, and then we will start the mock. All right. So in your exams, there are total 10 stations, out of which 2 are communication stations. So this comes after the history taking station. You'll have communication A and communication B station. Each station, you'll have to sit inside the station for 9 minutes, where you'll be given a scenario outside and you'll have 4 minutes to read through the candidate information sheet. So in this 4 minutes, you'll be reading the scenario. What I would recommend is you usually have a paper with yourself, a candidate paper, where you can note down specifically the names that most of us try to change the names. Never do that. So write down the name, basic information, and also you'll definitely have 2 minutes extra where you can think about, gather all your thoughts and see what you want to deliver in this communication task. So you can jot down your main points so that you'll be able to deliver it in 9 minutes. So gather your thoughts. That is very important. Be prepared before you enter into the station. And also sometimes there are lots of information outside. So filter through to see which is an important information. And at the end of the scenario, there is something called as task. So in that, they specifically give 1 or 2 tasks. So your aim would be to understand the background and then concentrate only on the task. So keeping it as simple as possible, and also having a minimal information to share would give you more time, and you'll be able to complete the communication in a full way. So like you'll be having time to wrap up. But if you beat around the bush, it becomes a difficult station. And one thing to notice, communication is a station where all of you will be able to get good marks, like aim for getting full marks, because clinical stations are sometimes tricky where you get only 4 to 5 minutes to do all the clinical station, unless and until you're very thorough and you are able to pick up all the signs and give a proper thing, you might tend to lose few marks over there. So these are the stations where you'll have to concentrate, like communication and video station, concentrate and try to get full marks so that you'll have leeway for the other stations, even if you mark a bit less in other stations. So concentrate on communication stations. There are many beautiful uh, uh, notes available which you can use. And also, if English is not your first language, there are also many sentences which are pre-made that you can always use it, and use it regularly. Practice. That is the key for communication station, nothing more. So this is how your marking paper will look like, which you can go through before your exams, and you'll be marked against these 4 clinical domains. So they will, it's only for 8 marks. Each clinical domain will carry 2 marks. So you'll be looked at if you're sharing information in a right way, where it's right, accurate, and if it is well structured. Also, next comes your communication skills, where they look into if you're having a good rapport, and also your communication style matters here. And then the third one is also very important, where you'll be looked for verbal and listening skills here. Apply to active listening. So if a role player says something, listen to it, acknowledge, and then reply. So in that way, it will mark you on active listening. And then finally, everybody has to do this. Like, you'll have to manage the concern. So the role player will be telling, like, he or she is concerned about certain things. So you address it. And also you make, at the end of the station, you make a plan saying what would be your immediate next steps. So there might be certain stations have long list of things to do, but you don't have to do all the steps. You can say what would be the immediate next step. So as we were talking, so you have 4 minutes outside where you'll be given candidate information sheet, and then 9 minutes inside. Once you finish 6 minutes, you'll have a warning bell to say you have 3 minutes left, and then your station ends. So you'll totally be spending 13 minutes to each communication station. So all these are available in the RCPCH site if you want to really look into how they mark you. And in communication, we have many different types of stations. So one is, these are some of the list, like information giving stations, talk about hydronephrosis. So you give some particular information. This is all information giving. And then breaking bad news, getting consent, critical incidents like any medical error and datics, all those stuff. And then you have certain ethical situations, educating either your colleague or a patient. And then there is always a difficult conversations, like where you sometimes see a teenager, or the parent might be difficult, who is not accepting for certain treatment or management. These would be the type of communication scenarios. Okay. So for all the communication scenarios, what I would recommend is have a common template, and some of the points might be more important for certain types of situations. So adapt it. So always have a template in your mind that will help you to go through the communication station smoothly. Like, first you enter inside, give an introduction, say what your name is, where you fit into this role, like what is your role exactly. Like, you can say I'm a registrar, or whatever is given in the scenario, and I'm taking care of this child. So say the child's name, and then you can introduce if you have any specific role related to that child. And then you prepare for the interview, where you make sure you confirm the patient, and make sure there are no interruptions from your side. Like, if you want to hand over the bleep or anything, you just hand over the bleep, and ask them if they want anybody else to attend the meeting with them. Or sometimes in certain situation, you can ask the midwife, especially when there is a newborn, you can involve the midwife, saying that I would ideally like to invite the midwife to this interview or whatever. Okay, whatever you're talking through. So prepare for the interview, confirm the patient, make sure there are no interruptions. Also make sure you already set like who you want to be there. And then you try to introduce the task as early as possible rather than beating around the bush. If there is a breaking bad news scenario, then you give a simple shot, like saying like, I'm concerned about something, so I want to talk about it. So that gives them a background that you're going to talk about something bad. So before introducing the task, give a shot and then start to introduce the task. Or if it is an education scenario, you can directly introduce the task. And then after you introduce the task, you do something called as a recap, where you say how much do they know about the task, like understanding their background. And then always say that you're free to interrupt at any time if you don't understand the content that is being spoken. Then comes the main part, where you deliver the information. In certain situations, the information is too big, like in an education, teaching an ECG or something, the topic in itself is huge. So in these situation, you can grossly introduce the topic and then say, you break the topic into chunks, like and then pick a single chunk, say that I'm going to talk about this to you, and then stick to that particular chunk. So once you finish the chunk, make sure you check. So this is something which is followed in UK. So you chunk and then check. So break the information into chunks. Once you deliver the first chunk, make sure they understand it, check, and then go back to the second chunk if you have time. And also while delivering information, it is essential to keep in mind that you have a sheet of paper. In certain situation, you might have to use it to draw a diagram, illustrate wherever it is needed. So that also gives a good impression, as well as it makes your talk very easy for the other person to understand. And then when you listen to the 3-minute bell, try to finish off whatever you're talking. So don't break it abruptly. Try to finish off the sentence, what you're talking, and then come back. Say you're going to summarize. So summarize and then tell them what the next steps are. And in this part, you will say that you're going to involve the senior, whatever team it is. You're going to give the leaflets, and finally you signpost them to a specific group. Like if it is a cancer or anything, you can go tell them about the support groups. Or if there is a complaint scenario, then you can talk about pulse. Like you'll have to signpost them. So that will complete your communication station. So if you have some template like this, it would be easy for you to just tick the boxes. So this will kind of cover most of the points needed for you to score. All right. That is a bit basic about communication mock. I'm not going to go in detail. So if there are no further doubts about the basics, we will start with the mock. So I'll give you 1 minute if there is any specific doubts, and then we'll start the mock. Okay, fine. So I'm looking at the names. So there is Pankaj, Jennifer, and then Nigel. I'll
Nigel,
come to you and get your name, Nigel. Okay,
Nigel.
fine. Sorry if I pronounced it wrong. Yeah, okay. I'll take mock from these 3 candidates. All right. Pankaj, are you ready?
Yes, ma'am. Yes, ma'am.
Okay. So I request all of you to keep your mics muted so that the candidate doesn't get disturbed. I'll try to tell you the time, but if somebody is not able to complete within the time, I can give you 2 or 3 minutes extra, but make sure you finish within the time, especially those who are going for exams. But if somebody is preparing new, you can still avail this opportunity, and I can give you 1 or 2 minutes extra.
Yeah. There is one question in chat box.
So, okay, so very specific. Okay, so somebody wants to know if you'll congratulate the mother when the child is having ambiguous genital. So whenever you go into any situation, always start with a positive note. So you can just keep yourself in a neutral position. So that mom has given birth to a baby. So you definitely say congratulations on your newborn. So you don't have to get into too much, you don't have to become very chatty, but you can congratulate her and then start about the topic. The way you congratulate, that matters rather than whether you want to congratulate or not. So I would definitely congratulate the mother, saying like, congratulations on your newborn, and then ask her, and then they would actually start the topic, and then you can tell them that there are some concerns that you would like to discuss. Okay.
Okay, ma'am. Thank
Okay.
you.
No problem. Okay. So Pankaj, your scenario is going to be there. I'll give you 4 minutes as an exam. Can you see the scenario?
Yes.
Okay. Your 4 minutes is up. You're ready?
Yes, ma'am.
Yeah, you can start.
Good morning. My name is Dr. Pankaj. I am one of the registrars in the NICO here. I believe you are Mrs. Sarah.
Oh, yes, doctor.
Okay, Mrs. Sarah. So how are you, Sarah?
I'm doing good. Thank you, doctor.
Okay, first of all, I would like to congratulate you for your baby.
Thank you. That's so kind.
You named your baby?
No, not yet. We are looking for some good names. Yeah.
Okay. Okay. All the best for that. Hope you will get a good name. Great.
Sure.
Mrs. Sarah, actually, I'm here to discuss about your baby's, reports. So, do you want anybody else to be part of this meeting?
No, doctor. I came by myself, so I'm okay. Is there anything serious?
It's actually we need to discuss about one test result. You might have known that we had some blood test. So that report has come. I'm here to discuss about that report only.
Okay. Okay.
So I have made sure that nobody disturbs us. Okay.
Okay.
Okay. So, Mrs. Sarah, we did some test initially, the Hill prick test, and after that, we did one more test to look for, thyroid status. So it shows that that level of the TSH is very high. So
Okay.
that indicates that Sarah is having a condition called congenital hypothyroidism. Are you aware of this
No, no. They said
condition?
they're doing some tests, looking for many conditions. So I've never heard what it is. Yeah.
Okay, so that has come positive for a condition called congenital hypothyroidism. So its level is very high. So I'm here to discuss about the further plan of about this, what we are going to do.
Okay. Will my baby be all right?
Uh, Hopefully everything will be fine, Mrs. Sarah, because this is a screening test, so we try to find it early so that we can intervene and everything goes perfect.
Okay. Okay.
Okay. Okay. Actually, our next plan is that we need to confirm this with some blood test, confirmatory blood test. Okay.
Okay. Okay.
Okay, but the level is so high that we will send the blood, but we will start the treatment for it.
Okay. So, do you mean to say it's very serious? What could have caused this, doctor? I'm sure, like, all my antenatal scans were normal. They said a baby was
Mhm.
fine, growing well. They didn't say anything about my baby, and he
Ye-
also looks very good to me.
Yes, yes, Mrs. Sir, I can understand that your everything scan everything were fine, and that there is no problem actually with that. It can't be detected that way. That's why we send this heel prick test. Are you with me?
Yeah, yeah. What could have caused this to my baby? Is there
Uh,
something that I've done?
Uh, no, Mrs. Sarah. It's nothing like that. Actually, this may happen to anybody. This is basically a problem with the gland here in our neck, here, this area that is called thyroid gland.
Okay.
Okay, so sometimes what happens that this gland is either, not well developed, or the problem in the hormone that it produces. So that may not be sufficient for the baby.
Okay. Okay.
Mm. Okay, and that's why it may cause problem because this is an organ which produces thyroid, which is very important for the growth and development, brain development, basically neurodevelopmental growth of the child.
Okay.
Okay,
Okay.
so that's why we plan to first confirm and we will start treatment because the level is really very high actually.
Okay. Do you mean to say, like, you've been stressing that the level is very high? Does that mean like my baby has not had This hormone, which is necessary for mental development for so long, then for past 10 months. Uh,
Actually, oh, for past 10 months. I mean, yeah, actually, what happened?
Baby is just like in my womb. Would that have affected the baby?
Not really actually, because in the womb, what happens that your thyroid level, helps in the proper growth and development of the baby.
Okay, okay, that's a bit reassuring. Okay,
So that's what our I'm here to discuss about that. We will start the treatment, and we will follow it up with confirmatory test, and maybe he will need the baby will need some jelly scan of the thyroid area as well.
okay, okay.
And also, we will involve
6 minutes up.
our consultant, and also the team of doctor, the gland doctor, and specialist nurse regarding this.
Okay, okay. So, okay.
Yeah, Mrs. Sarah. So that's our plan. So do you have any queries or any concern?
I'm sure I'll get lots of queries down the lane. As of now, I'm still in a state of shock. I'm just processing some information. Yeah.
Yeah, Mrs. Sarah, I can understand that must be shocking, and that's very natural. But hopefully everything will be fine, because this is a condition that can be treated completely if we start treatment early. So that I
Okay.
can, yeah.
Okay. So you'll be able to cure it after you start the treatment.
Mrs. Sarah, that is a very relevant question. Actually, this can't be cured, because most likely the gland is not functioning properly. But so the baby will need this thyroid supplement mostly for lifelong.
Okay. Okay. Will my baby be all right?
Yes, Mrs. Sarah, I can reassure you that with the treatment, most of the baby just does perfectly normal.
Okay.
We
Okay.
need to do the follow-up. We need to stick to the compliant to the treatment plan.
Okay. Okay, doctor.
Okay, Mrs. Sarah, if you don't have any concern, then I can recap for you what we discussed just now.
Okay. Yeah, that would be useful.
Okay, Mrs. Sarah. So today I have discussed about your baby's screening, newborn screening report, that it indicates that the child may have congenital hypothyroidism, for which we are planning for confirmatory test, and maybe may need some other test as well. And we will involve the team of doctors, like gland doctor and specialist nurse and our consultant, and also may need some other tests like jelly scan. uh, and then the baby will be started on the treatment thyroid supplement that may need for lifelong.
Okay. Okay, doctor. Yeah. Is this something that I need to do right now, or?
Mrs. Sarah, actually, right now we need to have some blood test for you as well, and also I'll suggest you, to have nutritious diet just stick to the plan that we have made, and regular follow up, all those things.
Okay, doctor. 9 months up.
Okay, thank you.
Thank you so much. Okay. That's a relief, isn't it?
Yeah,
9 minutes is up. Okay, well done. You did it really well. So I will start with you. So how do you feel the station went? What was positive? First, let's see what was positive.
Positive, I think I started really well. I started well,
Mhm.
and all those steps where I think I followed initial pro forma.
Yeah.
But where I got confused was whether it was confirmatory test or it was heel prick test. So that time I was slightly uh, I got.
Okay, yeah, okay, fine. Probably in exam. So this is so the stations that I'm giving here today, all the three stations are probably some of the recalls that people have already given it. So it is very simple, but usually in the exam you'll have bit detail. So it might say a heel prick test, which has showed a high thyroid TSH. So usually it would be like a delivering a newborn blood spot test. Yeah.
Okay. Okay. Okay, and then I think I tried to cover. I maybe it's few things I missed, like test on mother uh, and apart from that, I think I tried to
Yeah.
cover. Yeah.
Yeah, I think you covered most of the topics. Let's see on the flow if they have any other comments. Is there anything that you thought you forgot or you wanted to do better? Probably you'll think about doing it better next time. Anything in particular, which was like I know I've asked many questions because I'm a doctor, so I want to assess you. So usually it might not be this stuff, this many questions. But is there any specific question
The,
you thought you
that one question, that anything to for me to do right now, that I still am not able to process that. Is
Okay, that was just a question, so you don't have to worry. There was nothing. You told about mom's blood test. Probably you're looking for some transient hypothyroidism causes. So that's a good answer. You can say that I would like to reassure. So it is just kind of reassuring sentence. So nothing specifically hidden inside that question. Okay.
okay. Okay.
Okay. Okay. So to the flow, one by one, you can raise the hands if you have a specific question, or I can read through your chart. So read through the chat. So let's see. You can draw a diagram if you want to, but if it is just so somebody has asked, can we draw a diagram? It's purely up to you. You can draw a diagram. So sometimes when it is structural, then illustration becomes more specific and more useful. But if you're going to draw about hypothalamic pituitary axis and thyroid to a person to whom you're first talking about congenital hypothyroidism, probably you will cover that, but I'm not sure if you'll be able to cover most of the topics. Like here, you'll have to say what might have caused this, what you're going to do in terms of basic the first line investigation, and also you'll have to specify that you need to start treatment. In addition, especially in these cases, you will also have to talk about complication so that you make sure they are compliant, isn't it? So your goal should be that the child has congenital hypothyroidism. You should convince mom so that she can convince mom that this is treatable, but this is something you'll have to take care. So your mind should be focused on that rather than talking about hypothalamic pituitary axis. That is quite complicated, I would say. But if you're talking to a student or educating somebody else in the among your colleagues or a nursing student, or then you can probably talk about it. That is what I would suggest, because if I touch on hypothalamic pituitary axis, then it is going to take more time for me to explain. If they ask about more like what is this master gland, how does, then it becomes a trouble. So that is why I always say keep your communication very simple, straightforward, simple language, basic steps. That will give you more time to communicate well, like verbal, non-verbal, all that you'll be. Yeah. I would have asked the mother about her understanding about thyroid. That's right. Yeah. You could have asked, like he initially said it was congenital hypothyroidism. He could have asked, have you ever heard or anybody in the family who has had a hypothyroidism? Then I had a thing like my cousin had hypothyroidism, but it was not. So I had that in my mind. I would have said that, yes, you can always, so that you should check the background. That is also important. Is it lifelong treatment? Yes, it is lifelong treatment. So here, that is a good question. So here in congenital hypothyroidism, there are two types, isn't it? It could be transient congenital hypothyroidism, where the antibodies from the mother would have gone. So I'm not going to go into any of the theory, but you'll have to understand that there is something called as transient. So that is why you're going to do some blood test to see if it is transient or permanent cause. If it is a permanent cause, then the treatment is definitely lifelong. You will have to always reassure in these scenarios that this condition is not curable, but it is is fully treatable. The hormone which is deficient in your body could be replaced from outside. What is more important from the mother's side is that being compliant with all the follow-ups. So you'll have to educate us saying that initially we'll start on dose based on the weight, but you'll be frequently checking her hormone levels to see what dose that baby specifically needs. And also, as the baby grows, the need will increase, and we will constantly be following up initially until everything stabilizes. Once this is stabilized, then probably we can decrease the number of blood tests. But our overall aim would be to make sure there is a perfect balance of the thyroid hormone, as we think that is essential for the growth and mental development. And Pankaj rightly said, in the womb, so that is also important, isn't it? So they want to know whether it has already affected the baby. So when I ask such a question, what I would expect you to say is, so you can say, the basic reason why we do a newborn blood spot test is to find the diseases early before it affects the baby. So congenital hypothyroidism is one such condition where you can completely treat the baby even before the signs and symptoms appear. If we delay this, so this is the shot where you give to make sure they are compliant. If we delay the diagnosis or treatment, that is the time when all the complications will come up, like the baby might not feed well, they become lethargic, sleepy, they don't grow well, and then it can also affect the mental status, like they become clumsy and things when the dosage is not proper or it is not taken care for a long time. But the best part is this can be completely treated, and they can live a normal life like any other baby even without hypothyroidism, provided the treatment is appropriate and started early. They will be completely normal but will need a lifelong treatment if it is a permanent condition. Yes, somebody said that, yeah, we should rule out the transient by stopping treatment after 3 years. Yeah, if you're not doing a scan, then probably rule out. So here, I would say that ideally we would like to do send for some blood test and see if we can do an early thyroid scan. Sometimes there can be delay in this thyroid scintigraphy, but you can't delay the treatment. The queue may be long, the waiting time may be long. In that cases, you will have to start the treatment, unfortunately, even if it is transient or permanent, and then stop at some point and do. But this is, so whenever you're giving a new diagnosis to a child, stick to that point, deliver the diagnosis, see what your next steps are. You don't have to go into too much details, but you'll have to know the answers, because some of the role players can still be doctors. So you can sometimes be talking to a consultant, sometimes be talking to a grandparent who is already having some medical background. So for that, you might have to know all these medical knowledge. So Cindy, explain what TSH is. Yeah, involved. I think he did involve the pediatric and endocrinologist. He said hormone doctors. So he did. What about medical advice? So yeah. So somebody has asked, like Rosina has asked, what about medical jargons? Do we say like baby heel prick test suggestive of some thyroid problem? So you can introduce a medical term and then explain the term. So you can say that heel prick is done to check for thyroid problem. So basically, thyroid is a gland which sits in front of the neck and produces hormone which is essential for growth and development. So that doesn't come under medical jargon. So you'll have to say what thyroid is. Then it is not a medical jargon. Provide pamphlets, yeah, as I said, like always, give them the next steps. And then definitely in this, because you're giving too much information, these are the stations where you can say, like, I think I've given you too much information. I'll be available to answer any questions if you have in future. Write down any amount of queries you have. We can arrange for another meeting to clarify if you have any doubts, all those things. And also I can give you some written materials, pamphlets, leaflets for you to read through and get back to our team if you have any further doubts, along with gland doctor, neurodevelopmental pediatrician. So if it is a known case, so somebody has asked like 1+nod, okay. I would recommend people joining with their own name if that's okay. So along with gland doc team should include neurodevelopmental pediatrician. I think this is too far. You still the child is still not affected. So you don't have to talk about neurodevelopmental pediatrician. You can involve the endocrinologist, your consultant, and specialist nurse once the endocrine specialist nurse, once the diagnosis is there. So, but as far as you involve an endocrinologist and your consultant, then it is fine. Treatment permanent, yes, as we discussed, it could be transient or permanent. Once it is a permanent cause, it is a lifelong. Lacking sympathy. Okay. Right. Okay. So congenital is a jargon. Yes. Congenital is a jargon. But what you can say is the gland hormone is less because the baby is born with such a defect. We call something called as congenital. So when they are born with a hypothyroidism, then you call as a congenital. Okay. In UK, most of them, they understand heel prick, they understand thyroid, they understand congenital, but you can always break the medical jargon so that even if you utter some medical jargon, then say like, this is what it means. As far as you do that, you will not be marked for medical jargons. Okay, I think we have covered all the questions in the chat box. Anything in specific, any doubts in specific about this station? We'll have 1 minute time. If not, then we'll go to the next station. Yeah, you can say, do we need to say that thyroxine need to be started immediately is the question. So you don't have to say, but you should say that we need to start the treatment as soon as possible. If we are able to evaluate, we'll wait for a couple of days to evaluate. If not, if we are not able to do many specific tests, we will be able to start the treatment. Okay. If there are no further questions, should we thank you, Pankaj. You did it really well. Like I was happy. Like whatever the sympathy part and everything, I was happy. Like your verbal communication and listening skills, everything was fine. You can fine tune your medical knowledge, but then otherwise it's fine. So what generally about congenital hypothyroidism is that you can start with saying like this is a gland in front of the neck which produces a hormone which is responsible for growth or development. Sometimes there is a decrease in this hormone, which we call as hypothyroidism. When it occurs in a baby this young, probably they are born with this condition. So we call it as congenital hypothyroidism. That would be a quick kind of introduction into the topic. Then you can talk about the causes, saying it could be the thyroid gland problem in itself. The gland in itself can have a problem. Either it is absent or present in a different location, or there are few master glands as well, which uh, which help this gland to produce hormone. There can be defect there as well, or sometimes there could be certain transient causes, in which case the child will be we could stop the treatment if we find out it is a transient cause. So there you cover the causes. Then you say if the child so if the mom says it's affected, then you say there are certain signs and symptoms, but we diagnose even before the child is affected with any signs and symptoms. If they ask for signs and symptoms, you can say like poor feeding, sleepy, lethargy, constipation, and jaundice. These two are very specific in a newborn child. And if they are untreated and the child grows, then it comes for problem with mental development, learning difficulties, and clumsiness. So there you cover the symptoms. Then you talk about investigation, where you say you're going to send further blood tests to confirm the diagnosis and also see if there are any transient causes or other causes that can be ruled out through the blood test. And also he beautifully said, it is not only the jelly scan, Pankaj. Yeah, I wanted to say this. That is a nuclear scintigraphy. So that means they inject a specific dye which gets concentrated in the so you can just say a special scan will be done to know about the thyroid gland status, and stop there. You don't have to go into the details. And then sometimes there are association, and we'll check if we need to check the hearing screen. And then you talk about the treatment. Hormone replacement is there. Initially regular blood test will be done too until we find out the right dose, and you'll have to take the treatment lifelong if it is a permanent cause. That's it.
Okay.
So in that way, you'll be able to cover, that is your knowledge part. You'll be able to cover the whole topic of congenital hypothyroidism. Okay. Okay,
Ultimately,
Pankaj. Thank you so much. Okay. Hope it was useful. You are able to juggle at least 1 or 2 points extra. Yeah. Okay. So next, Jennifer, if you're ready. You're ready?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, let me put your same. I'll give you 4 minutes for the scenario. I'm gonna share.
Okay, ma'am.
Can you see the scenario?
Yes, ma'am.
Okay, perfect. Your 4 minutes starts. Your 4 minutes is up.
Yes, ma'am. I can start.
Yeah, you can start.
Uh, Hello, Mrs. Matthews.
Hello, doctor.
I'm Dr. Nancy, one of the doctors here, taking care of your child. Um, how may I address you today?
Yeah, you can call me Mrs. Matthews. That's fine.
Nice to know. Thank you so much. Mrs. Matthew, I would like to discuss something about your baby in the NICU. Is this the right time for me to discuss?
Yes, doctor.
Okay. Thank you so much. Is there anybody else would you like to join us in this conversation?
Uh, is there anything specific that's worrying, doctor?
Um, yes, Mrs. Matthews, we do want to tell you something about your baby. But before that, we wanted to make sure that if you want anybody else to join, they're most welcome, Mrs.
No,
Matthews.
my partner has gone home, so it's only me around. So yeah, you can talk to me.
That's all right as well. We can talk to you as well. Mrs. Matthew, before talking about your baby, I would like to first congratulate you on the birth of your child.
Thank you, doctor.
Uh, have you uh, have you decided on the name for your baby yet?
No, not yet, not yet.
Okay, that's nice. It'll take its time, definitely.
Yeah.
So Mrs. Matthew, what we would like to tell you is about your baby. Uh, your baby has received expressed milk from another mom.
Uh, did I hear that right? Did you
Yes,
say
Mrs. Matthew.
uh, did you say you've given milk from somebody else to my baby?
Yes, Mrs. Matthew. As part of our entire team and along with our team, we sincerely apologize for this mistake, what has happened, and your baby
That's
has received milk from another mother.
that's ridiculous. That's really ridiculous. How can be anybody be so careless? You've been asking my milk, so I've been storing enough milk. So the baby should have enough of my milk to be given, and there was no need for you to give from another mom. Is this how you even work?
I'm so sorry about that. I really understand how you feel. Anybody in your place will be upset, and we are taking this issue very seriously. We are trying to see where this mistake happened and why this mistake happened. We have raised an incident report in our department
Eh,
as to why this happened. Yes, yes,
how
yes.
can this happen? Is this how careless you are in NICU? Especially, we are trusting you guys on our small babies, hoping you guys do something good to our babies. And I don't think anything of that is coming real.
I'm so sorry, Mrs. Matthews. We have procedures in place. We do check the correct we do check the label before giving any child milk, but we are in the process of finding out why this error has happened. And we sincerely apologize for it on behalf of my entire team.
Can I know who exactly did this? I want to talk to that specific person.
Mrs. Matthew, we work as a team, and we cannot point out at one person because of which this mistake has happened. It
UNHS.
is a,
You better be kidding us, okay? You don't tell who did this, what has happened, and yeah, it's completely unacceptable. What happens to my
I'm
baby now?
Mrs. Matthews. Let me reassure you that we have checked on your child, and your baby is stable as of now. We are also taking due precautions. We have involved the infection team to assist us in assessing what kind of risk your baby will be under as far as infections are concerned.
So, do you mean to say my baby can get some infection?
Yes, Mrs. Matthews, we are trying to we are trying to work out what kind of infections a baby might have, and the infection team will come and assess the risk of the same.
What infection do you mean? Like, what do you mean?
Some kinds of infections, like some viruses, can be passed on through milk, such as some jaundice-causing viruses, like hepatitis B, hepatitis C, can be passed on, Mrs.
Oh
Matthews. And
gosh.
I sincerely apologize for this error on our part. And let me reassure you, baby is doing well now. Baby is stable now.
What will be what are the steps you're gonna take for my baby, like to not get all these nasty infections?
First of all, the infection team will be assisting us. They will come and assess your baby and to see what kind of risk it is. And they will be getting a couple of investigations for the baby. And also, we'll be checking on the milk what the baby has received to see if there any infection in that milk as well. We would be also informing the mom of the milk, the mom whose milk we gave your baby about what has happened because she also has the right to know that this has happened. And we will be taking it on further from there. And in our department, we have started an inquiry. We have raised an incident issue. We're taking this very seriously, and we are making sure that this kind of error
Six
doesn't
minutes
happen.
up.
This doesn't happen. We are also trying to see whether we can store different babies' milk in different shelves and have particular color coordinated bands for babies.
Okay, whatever. Can I know whose milk have you given to my baby? Which mom, so that I can have a quick chat with her.
I'm so sorry, Mrs. Matthew, but I will not be able to give you the name or the identity of the person. As protecting privacy of that mother is also our responsibility. I'm very sorry about that.
So, what are you going to do? Just make sure there's no infection.
We will be observing your child. We will be monitoring him, and as soon as the results are available, we will be informing you as well as your partner about baby's condition,
How
and we will
long
be
do you
following
think it will take?
the initial investigations will take 40 to 72 hours, and from then onwards, we will be deciding on what else we need to do.
Okay. Does this happen so frequently in your unit?
Let me assure you, Mrs. Matthew, we take utmost care, and our patients' health is a priority. And this error has happened, uh, and we're really sorry about it.
Okay. Whatever, whatever. So, should I be worried about these infections? You said jaundice causing infection. Is that all? So,
We are looking at other kind of viral infections as well, and one of which is HIV, Mrs. Matthews.
oh God, that is even more devastating. Oh.
I'm very
Has
sorry.
this ever happened to anybody? Like, have, oh gosh, is my baby going to be all right?
As of now, he is stable, and we will ensure that he receives whatever care he requires. once these investigations results come. And first of all, we'll be assessing him how much of risk he's had after having this milk.
Okay. If any of these are positive, do you think the baby will be affected?
Yes, Mrs. Matthews. Once these investigations come, there will be some risk to your baby, and but there are medicines and there are some medications which will be possible, but we can tell you about it only after we get the results.
Okay. 9 minutes up.
Okay. So, Mrs. Matthews, would you like me to give you some written material on these kind of problems, and would you like me to help you in any other way?
No, please do the investigation as soon as possible. And yeah, let us know what's happening.
Thank you so much for your time, and I'm really apologize on behalf of my team. This shouldn't have happened. And would you like me to summarize whatever we discussed today?
Yeah.
So, Mrs. Matthew, today your child has received milk from another mother, and as of now, he's stable. We are involving the infection team to see what kind of risk he is under, and we will proceed accordingly, Mrs. Matthew. Thank you for your time today.
Okay, doctor. Thank you. Okay. 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 Let's get back to normal. Okay.
Mother, mother was terrific, ma'am.
You did find her difficult, did you? Okay. Okay. How was your station? Like, what went well? What do you think you
Uh,
did really well? What you wanted to do it better next time?
uh, two, three lines. I kept beating around the bush. The same thing I was telling. I could have had more information on hand, and probably I could have. But I don't want to volunteer for myself for the pals, ma'am,
Yeah.
unless she asked for it. So I just held back that information. I don't know whether I could have given that.
Okay.
And one more thing was I kept beating on the bush. Sorry, same thing, infection, stable. I'll do this, I'll do that. I found that I could have added some more. Probably I should read some leaflets on this.
I think this is a tricky situation. Like, sometimes we are not sure how far to go, isn't it? Especially when they ask about infection. Yeah.
Yes, ma'am.
But you did manage really well.
Yes.
You wouldn't give any information, and you make sure the ID team is involved. Okay. Yeah, that was good. Okay. Uh, so if there are no further questions from you, so that was about Pulse, your question. We'll
Yes,
ask
ma'am.
from the people who have listened to the conversation. Any comments? Somebody is
Ma'am,
unmuted.
hello, ma'am.
Yeah. Hello.
Good night, ma'am. Ma'am, do we need to tell even about till HIV, with the only one episode, one time will given? So
Yeah.
will there be high chances that we need to inform this much to make mom so much worried?
Yeah, I think Jennifer pulled her best not to give any viral name. She tried her best, but I think because she had time, I kept on insisting on asking what virus. But you should be in exam, you should always be in a position to answer, even if the HIV question comes. That's a good question. So I'll answer to this question when I talk about the education, like I mean the medical part. Your content, when I talk about it, I'll let you know how you can address this issue about this infection. Okay.
Okay, ma'am. Should we say that only with one episode there are quite less chances that only one time
Yeah,
she
yeah,
received?
yeah.
Yeah.
I think, yeah, we can discuss this. So at the
Yeah.
after I take all the questions, I'll let you know like briefly about what are the infections that can happen, what exactly are the risks, and how you can manage gauge this situation if at all you come to a situation where they talk about HIV, hepatitis B and C, which is quite rare. So
Yeah.
we
Okay.
will
Thank
talk
you.
about it. Yeah, yeah. Any other questions? Okay, let me take questions from the chat. So you can't go after 9 minutes because this is not your exam scenario. I'm just giving you time. to check your summarizing capacity. That's it. So she was able to summarize in 40 seconds. That is a rough idea for me. So in exam, you will not have any time. After nine minutes, you will not even have a single second.
Okay.
Okay. I would have started with an apology saying I'm sorry, but an unfortunate. Yeah, that's how you start. I think she did apologize as well. Arrange a meeting with my senior consultant, an opportunity to lodge a complaint with patient services. Yeah, addressing here, you can always say senior consultant. So you can say she did mention about the incident report. So rather than rushing to tell your points, like an incident report has been filled, we are going to tell about the incident report, this is going to be documented and all this. Sometimes you can pause, take a break, tell it neatly, say that when such an incident occurs, this is not very common, this is very rare situation where this might occur. In these situations, we do incident reporting, and uh, this is done so that everybody comes to know that such an incident has happened, which will involve our senior consultants as well as the nurse in charge, and all of us will get to know what has happened. And also we'll look into the situation to see what steps can be taken in future so that this doesn't happen in future. So you can say like that, in that scenario, you'll be involving your seniors anyways. An opportunity to lodge a complaint with the patient services. I think here I was not very keen on complaining. I was rather frustrated with the care in the NICU. But if the patient wants to complain, then you say that you will not be on their way. You are free to complain, and you will be assisting them in complaints. Should we enumerate all the infections? No, I think Jennifer's technique was okay for me. Like generally saying there could be some viral infection, unless and until the mom specifically asks for what specific infection, then probably you can say this is your knowledge part, medical knowledge part. If they specifically ask, then you say HIV, hepatitis B. But when you start these scenarios, which is very tricky, you can always say you apologize and then say. So for Jennifer, one suggestion is, in a single sentence, you provided me too many informations, like there's a possibility of infection, so we don't want this to happen, we are going to. So you didn't give a break, so you were trying to give as much information without making sure
Sure.
I was with you. So try and
Okay.
avoid that. Be slow. I know this is a very hot situation. You just want to
Okay, ma'am.
talk more than the role player, because you don't want to take that scolding or whatever. But that is not a nice way. Like you can
Mm,
give them time, let them burst, and then after they burst, they settle down.
okay,
In
ma'am.
that situation, at that point you can say that we are going to do all these, we have done this for your kid, so we can talk that. So in this situation, somebody asked about hepatitis B, C, and should we mention. So what you can say is, unfortunately the baby has received a wrong breast milk, which doesn't normally happen. It has happened. We are very sorry. This shouldn't have happened in the first place. Now that this has happened, we are going to make sure the baby is safe. Meaning, there is a very low risk of transmission of some viral infection, which is practically very low. I think you'll have to stress on this. Practically, it is a very low risk. So coming to the medical background, here you can say like what are the infections that can transmit through breast milk is hepatitis B and C. But what are the infections that we screen is hepatitis B and C, but it is usually not transmitted by breast milk. So you won't get hepatitis B and C. CMV is something, one virus that can cause the infection, but because the milk is frozen, the cytomegalovirus dies in the frozen condition. So the risk is again almost nil. Syphilis is something that can happen uh, only if moms have cracked nipples, and uh, this can happen. But what is happening in UK is they screen all the moms antenatally for syphilis. So that risk is also very low because they screen all the moms and usually they are negative. Only if there is cracked nipples, then there is a possibility provided mom is positive. That is also very low. HIV, even if the mom is HIV positive, if the mom is planning to feed her own baby continuously, the risk of transmission is 1%. But this is a very small aliquot of milk that the baby has received from some other person. So even if there is anything positive, the possibility of the baby getting infection is almost negligible. But having said that, we don't want to miss even to take even the slightest chance of the baby having the infection. If you put like that, it will put their mind into ease. You can say that we are going to screen this infection, which is practically very low risk. Still, we want to make sure the baby is safe. Okay. And here,
Okay, ma'am.
what steps you actually do is, now that the baby has received the wrong breast milk, so you have found out. So you're telling this, and then you'll have to say you're going to aspirate the milk, whichever is remaining in the tummy. So that would be your first step. And then you will also say that you're going to talk to the donor mom, like from the milk from whom the baby has got, to see if you can get any reassuring information. So we will be having a discussion with the donor mom to check if this baby is at any risk of infection through antenatal screening. And also we will ask her consent before we could share any details in terms of her medication use. Was there any cracked nipple? And all this will help us to check for the risk, possible risk. What is the degree of risk? And then you rightly said will involve the infectious disease team and do some virological testing based on how much risk the baby has. Another thing you will have to say is, we have discussed this, and I'm also going to document all this conversation in the baby notes to make sure everybody comes to know. And then we are going to fill something called as incident reporting, where the senior staff members, the senior consultants and the nurse in charge will get to know about the incident, and there will be an investigation to check out where the safety check has been missed. So, and also necessary steps will be taken to make sure this doesn't happen in future. Thank you for your understanding. So this is what the medical background is about this breast milk, wrong breast milk. So let me see if you have any further questions. Yeah, that is also a way of saying, like Savita has said, can we say all the mothers here are screened for major illness? Like, so they screen for HIV, syphilis, hepatitis B. Yeah, so mostly it is negligible. That's why you'll have to say somebody has raised their hands. Okay, you'll have to say that we will get reassuring information from the donor mom before we say what risk it is. Even if there is any risk, it is very low. That is the information you're going to transfer to the mother. There is no need to apologize repeatedly, just at beginning and at the end. Okay. Yeah, I think Ahmed has said this. It varies. So if the mom is really angry at every point, you can say apology. You don't have to say only sorry, sorry, sorry. There are many types of apology. So you can initially start with sorry. Unfortunately, this has happened. And again, if she says we can't trust you, I'm sorry. We are in this position. Let me reassure this is not something that would happen frequently. So you can change your sentences.
Okay, ma'am.
Reassuring about baby could have been raised early. I think she first sentence is what she said. The baby is stable, but we are looking into it. Some long, yeah, I think the sentences were quite long. That could have, like, yeah, you can improve on it. Most of the mothers are screened for the to reassure. Yeah, not well structured. She was very fast in explaining why this part was not clear. Yes. So Anu Martin, virus part was not clear, ma'am. So if you have any specific questions, okay, let me ask. Somebody raised their hands. Was it Naresh
Ma'am,
Kumar?
yeah.
Yeah.
If she asked what type of the infection can be happen, can you tell me? So should we say that there is a very less chances of the bug can be transferred by the breast milk to harm your baby?
Yeah, it is practically very low. The risk is practically very low, but we do
Mhm,
screen for certain viruses which could
mhm.
transfer through breast milk.
Okay.
And all this risk are for those mothers who feed the baby regularly. But what I want to reassure you is that the baby has received a very small aliquot of the milk from other mother. Even if she is positive, it's very small, that the risk could be negligible, but we want to make sure there is no risk.
Means I mean to say we should not tell hepatitis and or syphilis or all these things. It
You
is much
don't have
better
to.
because
Yeah,
she is already angry.
that's
So
right.
we can
That's right.
say,
So
yeah,
yeah. So
sure,
first you
sure.
apologize for what has happened. Like this should not have
Mm,
happened. Now that this has
mhm,
happened, there is some risk of viral infection. You can stop with that. I think Jennifer tried her best not to name the viruses,
mm,
but I was the one who asked her what virus in specific to
mm,
check the knowledge part from her. But you can
mhm,
just blanket cover it with saying that there are possibility of
mm,
viruses being transmitted through breast milk,
mm,
which is almost negligible because this is a small aliquot of breast milk that has been given. And also we would actually aspirate the milk from the tummy if anything is remaining, so that it is not absorbed. And then if they are still wanting to know, then you can say these are the viruses, but most of it is screened antenatally. So most of them are negative, and even if they are positive, they are usually treated, which makes the risk very low. So
okay,
you
thank
keep
you.
on saying that the risk is very low, practically very low. You'll make sure the ID team is involved and then take the necessary. What they generally do in UK is they do virological testing in the donor mom and also the
Mhm.
recipient baby. So that is what they do if we need to screen. So yeah.
Ma'am, one query. Ma'am, you said that you will remove the milk. So when we talk to the mother, we say that once we knew about once we got to know that such a incident has happened, we removed we aspirated the remaining. Can we do we tell like that, or how do we
Yeah,
tell
you
it?
can. As I said, like sometimes the scenario is big, they might have told, or
Mm.
sometimes this can be a knowledge part where you can say that now that it is known, we will be removing the remaining milk which is in the tummy, or we have removed the milk which is in
Mm.
the tummy, if that is the routine practice.
Okay, ma'am.
Okay, ma'am, ma'am, in this type of apology scenarios, will we call for attendant?
So I think in most of these scenarios, the role player, the role player, they will be ready for this answer because invariably all the candidate is going to ask for this and they will say no. You can ask as a part of your completion, but the role player will not be knowing what you're going to talk about, if that makes sense. Isn't it? She's just there to talk about the baby. She doesn't know if it is worrying, if it is a breaking bad news or anything. But you can ask it for your completion sake. Like, is there anybody else along with you while I discuss about your baby?
Okay.
Ma'am,
Ma'am, can we ask for some chaperone from our side, like a nurse or something, before going ahead in such scenarios?
So why do you need a chaperone? What is a chaperone?
No, basically, when we are dealing with somebody who's angry, do we need
So
somebody?
in this case, what would be ideal more than chaperone is the midwife. So midwife is somebody who's involved in both the baby care and the mother's care. So each mother will have a specific named midwife, or there is a midwife who's taking care. So you can inform the examiner that I would ideally like to call the midwife while we discuss this topic. Yeah, you can say that.
Okay, ma'am. Thank you.
Midwife will be better. Yeah.
Yeah.
Ma'am, there's one question which I have come across. If the mother asks, can I know the other mother's reports after it comes? So how do we tell that?
Yeah, so this is where your steps come. First is removing the milk from the tummy, and then you say you're going to obtain the reassuring information from the donor mom, where you are going to ask specific questions and also look into her notes to check what is the risk of the baby for the recipient baby. But you won't be able to disclose the person's name, confidentiality, but you'll be asking the donor mom's permission to see if you can tell about the information needed for the recipient baby in terms of like if there is any infection risk, only if she agrees to, like in infection risk, was
Okay,
the
ma'am.
cracked nipples, in the sense, was there any blood in the milk, and all those information, medication information, all this you will be obtaining from the mother, and you can tell her that I'll be able to give you the information provided the donor mom consents to it, but I won't be able to tell you the name or the person due to confidentiality.
Okay.
Yeah. So all this virological testing the ID team will do when they don't have a reassuring information, or the donor mom denies to give uh, any information at all, that she doesn't want anything about her being talked. In that cases, then the ID team comes into play, where they do virological testing for everyone.
Okay.
Okay. Yeah. Okay. Okay. I think we have taken so much time. Let's do one last scenario.
Thank you, ma'am.
Nigel, are you ready? Thank you so much, Jennifer. Sorry. Thank you so much. Uh, so, Nigel, is that right,
Nigel,
Nigel?
yeah, Nigel. Okay.
Nigel. Okay. Nigel. Okay, fine. Uh, are you ready for your
Yes, ma'am.
station? Okay. Okay. Yours might be a bit difficult. Uh, let's see. Can you see the screen?
It's just loading, man. So, yeah,
Yeah. Okay.
yeah, no, I can see.
Your 4 minutes starts now.
Hello.
Yeah, your 4 minutes is up. You're ready.
Oh, yes, ma'am.
Yeah, you can start.
Hi, aren't you one of the nursing students posted here?
Oh, yes, doctor.
Yeah, hi. Uh, uh, can you please, how would you like me to address you?
Yeah, you can call me Carolyn.
Oh, okay. Hi, Carolyn.
Hi.
Uh, so, how are you finding your postings in the pediatrics department?
Yeah, it's generally interesting. It's just that, yeah, yesterday I saw a child that was a bit upsetting for me.
Oh,
So I
okay.
thought I'll talk to one of the doctors to see what
Okay,
exactly.
yeah,
Yeah.
okay. Okay, yeah, okay. Okay. So why don't we go to the discussion room where we can have a more private chat?
Yeah.
Is it okay?
Yeah.
Sure. Okay, please. Yeah, can you just elaborate on what is the situation you saw, and like what concerns do you have?
Yeah. I'm not sure if you know about this boy. Yesterday we saw
Okay,
who came to A&E probably for some injury while
okay,
playing, and then they did an X-ray. I don't understand much of these bits, but then they said they could see something different, something called
okay,
as osteosarcoma, and they are planning to post the child
okay,
for a procedure.
okay,
But the consultant was very sure that he doesn't want to this information to be told to anyone. So
okay,
that bit was really confusing, doctor, because we always talk about being honest, open, truthful, and this really disturbed me. Isn't there the right for the parents to know what's happening with the child?
okay. Yeah, I understand the situation has been particularly distressing for you. Okay. Yeah. So, like, do you know what osteosarcoma is actually? Like, what does it mean?
No,
Yeah,
probably something related to the bone.
yeah. It's basically a cancer of the bone tissue. And it's one of the very most commonest tumors that happen in pediatric age group, especially in the bones. Okay,
Okay.
so you're saying that since I have not seen that baby patient personally. So your concern is that the parents needs to be informed about that, correct?
Yeah, yeah, isn't it? The patients need to know. That's what
Yes,
we
yes.
always talk about. That's what we are
Yeah,
taught.
I
Like,
understand.
yeah, it's so quite
Okay.
contradicting.
Yeah, yeah. So yeah, and I completely agree with you that we have to be always very much transparent regarding a patient's continuing condition, especially such a young child, especially to the parents. Yes, but the main thing I think I most probably feel that the consultant would like to get a confirmation on the test before they would like to approach the parents and the children and the child regarding regarding such a upsetting news. I think that is what is there. I think that is what is his ideal approach maybe.
Okay,
Yeah.
okay. So the child is posted for a procedure.
Okay.
Wouldn't you say? Like, yeah.
Okay. Yeah. So I would look into it. I would like to look up the patient's file if possible, and then I will also inquire with the consultant what is the reasoning behind not informing that I would like to look into it. I will and then I will get back to you regarding that. Since you have told me about this, ideally I would also be informing, especially if they are planning for any invasive procedures. They would have to explain to the parents prior to that. So
Yeah,
yeah,
yeah.
and I completely agree. So what I can do is I can go and have a look at the patient and maybe I can ask for a opinion from the I would like to discuss with the consultant. Is there anything that is preventing him from discussing with the parents?
Yeah, okay, okay.
Yeah.
So you mean to say the consultant was wrong, isn't it? You shouldn't be uh,
Since I'm not that much
hiding.
familiar with the patient's condition, I can't comment on it, but I would definitely look into it. Why is there is a
Okay,
reluctance into
okay,
sharing the information?
okay, okay, doctor.
Yeah. Okay. Anything else that is concerning me?
No, no, just this. I
Okay.
was like, do we even have rights to withhold information? That was quite, yeah, I could not process the information well. That's,
Uh,
yeah.
there are certain special situations where we have to like, especially if the child is in like any kind of a legal battle between like parents and like who's having the right to take care of the parent, take care of the child and all. In those cases, we are bound by the law that we can only share information to certain individuals. Like that is also there. Uh, like you may not be able to share the information if the one of the parents is not the current guardian of the child. There are code since there are certain legal situations where we would have to withhold information even if they are biological parents because yeah
Okay,
we have to we have to conform to the court orders also. And there are some other special situations like where the child is endemic is a ward of the government, like the ward of the state, and then in those cases also it may be if given an order from the court, we would have to follow it.
okay. 6 minutes up. Yeah.
Yeah. Okay.
Okay,
Yeah.
okay.
So anything else you would like to discuss with me?
No, that's it, doctor. I just wanted to know about what this thing was. Yeah, nothing more.
Okay. Yeah. So yeah, this is a very one of the significant ethical conundrums that would come across in your life in the medical in the healthcare sector. So I hope I could address all your concerns. We have we all the hospitals have their own protocols and ethical guidelines. You can have a look through it, and if you have any other further queries, we can have another discussion over a cup of coffee.
Okay, yeah, sure.
Okay, so. I hope you have that's your concerns. So we discussed about so just to summarize, we discussed about an ethical conundrum we faced regarding the withholding an information from a parent and the child regarding a very serious condition the child is suffering from. I hope I was able to address all your concerns. I told you about the special situation where they have to hold, and I also assure you that I would be looking into the patient, the patient which you informed about, and regarding any other particular reason why the consultant is withholding the information. Is there anything else? Uh, I will look into it, and I'll get back to you. So,
Okay. Okay.
okay, sure. Okay. Have a nice.
You too. Thank you, doctor. Okay. Have you finished?
Yeah. Yes.
Okay.
Yeah.
Almost 8 minutes. Okay.
Yeah.
How did you feel the station was?
This is a very confusing scenario. I mean,
Yeah. Yeah.
yeah.
So, can you still see the scenario? Or?
No, it's off. No.
Okay. So, what did you understand? Okay, let's talk about what went well, what didn't go well, and then we'll go back to the question. Yeah. What was confusing about this scenario? Nigel, can you hear me?
So I can hear you. I can hear you. Sorry.
Yeah. Okay.
Mhm.
Was there any confusion for you in this scenario, or
Yeah,
any trouble?
yeah. I didn't understand what is was it a legal issue? I had to go against go report it to the hospital or not. I'm not sure. That is what I
Okay.
mean. Yeah.
Okay. Okay. That was your question. Okay. Fine.
Yeah.
What went well? What do you think went well?
My intro and the setting was good, I think. Then later on, I don't know. Like that was, I think, which was good one went well.
Okay.
Yeah.
Okay. So, do you have any specific question about this scenario?
Yeah,
That I,
my question is is it like an ethical situation which I should have reported, or like I didn't
okay.
understand. Or
Okay.
is it something
Okay.
that I should confirm to? I didn't understand.
Okay. 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 So you were confused whether it was something wrong that you had
Yeah,
to report to the ethical question. That's your question.
yeah,
Okay.
yeah,
I'll get
yeah.
that. Okay. We'll address this.
Mm,
Anybody else? Any other questions? Okay. Let's see. So 4 pillars of ethics. Somebody talked. Yeah. Yeah. So always for any ethical situation, I think you can prepare this autonomy, beneficence, non-maleficence, and justice, and fit
mm,
these into the ethical situation. That is also a right way. I'm reading through the comments to see if there are
mm,
any questions or if people are being confused. Okay, maybe it is good to congratulate the student for her sensitivity and tell, yeah, that is a way of building the rapport,
mm,
and tell here that the diagnosis has not been confirmed yet. Nurse thinks that the information should be shared, but tell her that consequences that may happen, such as leaving the hospital, etc. Okay. Okay. Praising her, yes. I think, yeah, that is the way you build the rapport, isn't it? And then ethical issues needed to be discussed. Yes. You can bring that ethical, like your background about ethics, all those 4 pillars. Invoke the principle of non-maleficence, do not harm. Okay, probably too early to disclose about the malignancy without much proof. This may be advertly impact. Okay. What do you say regarding the procedure? Okay, what should the team say the parents to get the consent for that? I think, yeah, this is not a consent situation. So somebody has already obtained a consent for the biopsy. So the consent you can easily saying that the X-ray shows something different. You don't have to specifically say it is an osteosarcoma. So somebody would have got a consent, and then you would say like you want to do a biopsy to ensure
mm.
what exactly is causing the. This could be sinister or this could be a benign condition. That is how you get a consent. So okay, there are no further questions. So this is, I'm going to share the question again for us to read through and get a better idea now.
Okay.
Okay. So can you see the question?
Oh, is it?
Yeah. So initial paragraph is your
Mm,
background knowledge. Here it says there was a 15-year-old boy who was playing, had trauma, and the X-ray showed osteosarcoma. He's posted for biopsy tomorrow. That is all, none of our business. This is just the
mm,
background information. Consultant is
mm,
of the view that the condition should not be disclosed to anyone. That is his opinion. And a nursing student is observing all this. And she is confused why this information is being withheld. So my question as well when I entered the station is the same, like, isn't it? I always, like, we always talk about being honest, open, transparent, and why is this not being followed? But look into the next line. It says what your task exactly is. So in ethics, there are various components of ethics. Here it talks about you'll have to discuss with her the ethics of withholding information. This is a separate topic in itself under the ethics. So we generally see ethical situation where we talk about the 4 pillars. This is a specific scenario where we talk about ethics of withholding information. So if you want more information on this, you can actually go to RCPCH or just Google it saying ethics of withholding information UK. You actually get a beautiful article which says what is it. So that will give you a better understanding. So basically here you're going to talk only about ethics, not about this specific case scenario.
Okay.
So you'll talk about ethics of withholding information, because in this scenario you are not there, you were not involved, you don't know what exactly happened, you don't know what has caused the consultant to make this decision. So you can leave it there. You can say, like, I have not seen the child, that was right, like your approach was very good. I have not seen the child, I am not very sure about why the consultant has decided this. But what I would like to know is, this is a situation where there are some ethical dilemmas. In these cases, it would be ideal for us to look into the ethical guidance, which is given by the GMC and RCPCH. This is like signposting her towards what is appropriate. So we, day in and out, we encounter many situations where some of the situation are ethically tricky. But as doctors are treating people, we usually have something called as we can withhold information in special scenarios. That's what exactly you said. Uh, like in special situations, we do withhold information, which is called as therapeutic exception or therapeutic privilege, where in exceptional circumstances, we delay sharing information needed for making a decision because it might cause some serious harm. But in these cases, so you should explain this to the nursing student. But in these cases, we usually tell them that there is more to discuss and we'll make arrangements to share all the information as soon as it is available and when it is appropriate. And in these exceptional situations, sometimes we might have to seek the legal advice. And also, we usually record why such a information was withheld and what arrangements have been made to clear this out. Okay, and then you also reiterate then, yeah.
Can you say like with an example, like how do we like in this like the for the therapeutic version of that?
So when the what I would have done is, when the nursing student said, like she did say that we always talk about being open, honest, and being transparent, then you can appreciate her saying that, yeah, you do have a very good knowledge about what is ethical, and you're right. In almost most of the cases, in majority of cases, this is what we follow. We want to be open, honest, and transparent. As we all know, we have a basic framework which says autonomy, beneficence, non-maleficence, and justice. So you can generally tell, like, a patient has the full right to know about his condition, and also we are bound to make sure we do good by giving the information and we do not do any harm to them, and also treat them equally. This is what our ethics teaches us. But in certain circumstances, when we feel that certain information can cause more distress and more, which we think could be a serious harm to the patient, we can delay delay in saying the information. You can't withhold, you can delay in saying information. But you did mention few of the examples, like all those, you can do that way as well.
Okay.
Do you get it?
Yeah, understood.
So here you only have to discuss that there is an exception, therapeutic exception or therapeutic privilege, that is sometimes followed, but you don't withhold the information. You will be telling this information later. So you make the arrangements for them. And then you can discuss with the nursing, why did you feel like this is wrong? Then she may say, like, what we talk about. Then you say, that's right, whenever. So we should try not to do this. At the maximum, we should give them all the information possible, because withholding any information breaks basic trust between us and them. And also it is kind of violating the autonomy. It is always the risk versus the benefit, whatever ways. And in these tricky situation, it is essential that we involve the senior persons and the consultants. And also every hospital has a ethical committee where we can always discuss such cases to make sure what we are doing is right, and also document them. So you just have to talk about all these 4 points and give something about ethical, and also know that there is something called as ethics of withholding information. This is what is expected.
Okay.
Ma'am,
Yeah.
excuse me, ma'am. Ma'am, can we say that this could turn out something else, because biopsy is the thing that will
Yeah.
actually confirm the diagnosis by staging and grading. That way, we will have confirmed information. That way, might, say the mortality, or so, that in the initial stage and grade, it will be having good mortality, good prognosis. Sorry, good prognosis, and later stages, grade stage 3, stage 4, it will be, so. And also we will have a meeting with the oncology team, and then finally we will be involving parents and oncology team, and all. There will be a meeting, and then we will be informing parents
Yeah.
with the
Yeah.
team, with the
Yeah.
consultant, and with the oncology team.
Yeah, if the nursing student specifically talks about that specific scenario, then you bring that scenario into the your explanation conversation. But if the nursing student is worried only about why you're withholding the information, then you talk about ethics, if I make sense.
Okay, ma'am. Thank you.
Yeah. So in this, she is worried because you're holding some information. She doesn't know anything about osteosarcoma. Neither is she interested in osteosarcoma. She wants to know because there has been some contradiction between somebody has said like what you should be doing to the patient versus what she has seen somebody doing to the patient. So you should gauge your conversation according to what the role player is acting for. So if she is very specific about this osteosarcoma should have been said, then you can say we don't have a confirmed diagnosis, and this is something a sinister diagnosis like a cancer, which could be very shocking. Probably because the consultant might have outweighed the risk more than the benefit about sharing the information. He might be waiting for the biopsy, as you guys said, like biopsy to make sure what the diagnosis. So this is not withholding the information completely. We'll come back to this and then talk about it later. This is something called as the ethics of withholding information. You can also bring the topic like that, but you'll have to introduce the topic that there is something called as ethics of withholding information. Okay.
Okay, ma'am. Thank you so much.
No problem. Thank you. Any other questions? For ethical situations like this, if you don't have anything, always make sure you know those 4 principles. You talk about autonomy, doing good, no harm, and then gauging yourself in. Because ethics is not something that we all will read in and out. Okay. Okay, if there are no further questions, I think we'll wind up the session. Thank you, guys. It was a
Thank you, ma'am.
pleasure. Thank you so much. Thank you.
It's
See you.
excellent
Thank
session,
you.
ma'am. Thank you.
Thank you.
Thank you so much. My pleasure.
Thank you, ma'am. Thank you.
Thank you. See you.
Mhm.
Thank you so much.
Thank you.
Very nice.